Just a nurse. That's what Dr. Sterling called her when she was hired, 3 months ago, his voice dripping contempt like antiseptic on a wound. He didn't know. He had no idea who was walking through the employee entrance at 11:56 p.m. with a canvas duffel bag and eyes that had seen things no civilian hospital corridor could prepare for. Laura Bennett moved through Mercy General's night shift like a ghost, her rubber-soled shoes silent on linoleum that reeked of bleach and something underneath, old blood, maybe, or just the smell of suffering compressed into floor tile. She'd been working the vegetative care unit for 12 weeks exactly. Not that she was counting. She was always counting. The break room fluorescent lights hummed their mechanical prayer at 2 in the morning. Laura stood in front of a coffee maker, watching the dark liquid fill the styrofoam cup held in both her hands. The tremor was back. It always came during quiet moments, the shaking that started in her forearms and traveled up to her shoulders like electricity looking for ground. 18 years. 18 years and the muscle memory hadn't faded 1 inch. Her hands moved the way they'd learned to move in a field hospital 200 miles south of Kabul, where the coffee was cold and the casualties came in like waves. She wrapped her fingers around the cup tighter, using the heat to anchor herself to this moment, this place, this life that was supposed to be small enough to disappear into. The break room door swung open without warning. Boots on tile. The sharp percussion of someone who owned space. Laura didn't turn around. She knew the sound, had heard it in 100 variations, officers walking through medical tents, the weight of rank in every footstep. This one was different. This one was arrogance. Bennett. Not a greeting. An announcement. Dr. Sterling stood in the doorway like he'd been installed there by the hospital itself. White coat immaculate. Cufflinks that probably cost more than Laura's monthly rent. Eyes that calculated the distance between his position and everyone else's, always measuring, always finding them wanting. He was 48, maybe 50, with the soft bulk of someone who'd never been hungry, never had to choose between water and insulin, never understood that survival wasn't something you discussed, it was something you did. Laura turned slowly. Still held the coffee cup. Didn't look directly at him. Just the periphery. Just enough to show deference without giving him anything else. I'm reassigning you. Sterling's voice carried the cadence of someone accustomed to obedience. Room 347. The General. Vegetative care. You're his primary now. He extended a manila folder. Thick. Heavy with pages. Laura accepted it with her left hand, keeping her right wrapped around the styrofoam. The shake was worse when she had to think about it, so she didn't think about it. She just took the folder. Yes, doctor, she said. Soft voice. The one she'd practiced. The one that fit her new skin. Try not to mess up the paperwork. The military's very particular about billing. He smiled. It wasn't kind. Dismissed. She was already invisible when he turned away. The folder stayed closed in her hands until she reached room 347. The hallway to the vegetative care unit was quieter than the rest of Mercy General, as if the hospital itself held its breath here. Machines breathed for people who couldn't. For lines carried sustenance into bodies that would never digest a meal, never taste food, never wake up and ask what day it was. The smell here was different, less antiseptic and more like the weight of time, like years measured in bags of saline and stacks of charts that nobody wanted to read. General Marcus Webb lay in the bed like sculpture. 5 years. 60 months. 1,825 days that he'd been asleep after the IED took out his convoy in Sangin Valley. Laura knew Sangin. She knew the dust that got into everything, the kind that turned your sweat into mud and your lungs into something that didn't quite work right anymore. She knew the heat. She knew the sound the ground made when it wanted to kill you. She opened the folder. The photograph was from his file, a man in desert camouflage, jaw like granite, eyes that hadn't yet learned how to carry what they'd seen. 4-star general. Special Forces background. 2 tours in Sangin before the blast. The chart detailed the injuries with the precision of a museum catalogue: severe traumatic brain injury, multiple fractures, complete loss of consciousness, minimal brainstem response. A body that was still alive because someone had found him in the rubble and the medical evacuation team had made it in time. A body that had been waiting 5 years for permission to die. Laura pulled the chair close to the bed. The metal legs scraped against tile with the sound of fingernails on concrete. She sat down. The general's chest rose and fell with the mechanical rhythm of the ventilator, his breathing synchronized to the machine like a duet neither of them had agreed to perform. She opened the thick file on her lap and began to read. The charts were meticulous. Too meticulous. Every vital sign logged, every medication documented, every procedure recorded with the kind of obsessive detail that only happened when someone was protecting themselves. Laura's eyes moved across the pages, cataloging what the numbers meant. The general's medications included 3 different antibiotics that he shouldn't be taking if he wasn't fighting an infection. His fluid intake was logged, but something was off in the proportions. The physical therapy notes referenced work that she'd seen no evidence of in the room: no ROM exercises, no positioning, nothing that suggested anyone had touched him except to change him or keep him alive. She looked at the ventilator readout. The settings were standard, appropriate for his weight and condition. The oxygen saturation looked good. Heart rate steady. Blood pressure stable, though lower than she would have expected. She reached forward and gently placed her fingers on the radial artery at his wrist. The pulse was there, strong, regular, the signature of a body that hadn't given up yet. "Hey," she said quietly. Soft voice, the one she used. "I'm Laura. I'm going to be taking care of you on night shift." The general didn't respond. His eyes stayed closed, his face still as marble. The ventilator hissed. The monitors beeped their digital alphabet. The sounds of a hospital in the middle of the night, when the world was asleep except for the people paid to watch it. Laura leaned back in the chair and began going through the files systematically. She took notes. The charts were written in Sterling's handwriting mostly, though there were signatures from other attendants, nurses, even a cardiology consult from 8 months ago that didn't make sense given the clinical picture. She made a mental list. Mental lists were better than written ones. Written ones could be found. By 4 a.m., she had the rhythm of the room memorized. The ventilator cycled every 6 seconds. The heart monitor beeped once per second. The full pump dripped medication on an 8-hour cycle. She knew when the machines would need adjustments. She knew what the general's baseline looked like. She knew, with the certainty that came from doing something 1,000 times before, that something was wrong with his care. She checked the medication bottles against the chart. Everything matched. Everything was documented properly. Everything looked exactly the way it was supposed to look if nobody was paying attention to what the numbers actually meant. 3 hours later, at 7 a.m., the day shift began to arrive. Laura heard the boots on tile before she saw them, the sound of staff coming in to relieve the night nurses. She closed the file carefully and stood, her body moving through the motions that felt safe, deferential posture, eyes down, not making waves. She'd spent 3 months perfecting the art of taking up as little space as possible. Dr. Sterling appeared in the doorway of room 347 just as she was preparing to leave. He looked at the general, then at Laura, then back at the monitors. His eye scanned the machinery with the expression of someone checking a parking meter. Professional. Detached. The expression of a man who'd never held a dying soldier's hand while waiting for the medevac helicopter. "How was he?" Sterling asked, not looking at her. "Stable," Laura said. "All vitals within normal limits. I've documented everything in the chart." "Good." He turned to leave, then paused. "You seem competent enough, Bennett. Try to keep it that way." He left. The door swung closed behind him with the soft hiss of a hydraulic closer. Laura stood in the quiet room for another moment. She looked at the general's face, at the way his chest rose and fell with mechanical precision, at the way his body had learned to survive even though his mind had given up. She thought about Sangin. She thought about the taste of dust. She thought about her 15-year-old son, Marcus, who she'd named after a general she'd served under, a man whose son she'd never mentioned, whose whole military career she'd erased from her civilian life like scar tissue. She pulled the worn combat boots from her locker on the way out of the hospital. She'd brought them from home 3 months ago and never worn them, just kept them in the bottom of the metal compartment behind her spare scrubs. They were old. Dust from Sangin still in the laces, the same dust that would never wash out, the same dust that had traveled home in the fibers of her hair and her clothes and probably her lungs too. She held them in her hands and breathed in the smell of that place, that time, that version of herself who knew exactly what she was doing. Then she placed them back in the locker, closed the door, and walked out into the Portland rain that had just started to fall, her hand steady, her mind already returning to the patterns she'd learned to recognize in medical charts. Something was wrong. She could taste it like copper in her mouth. And that's when the real problem began. The room fell silent as Dr. Sterling tapped his coffee mug with a spoon. 20 staff members turned toward the sound, attending physicians, residents, 2 orderlies grabbing lunch between shifts. Sterling stood at the center of the cafeteria like a man about to announce a grand prize. His voice carried the weight of absolute certainty. "Ladies and gentlemen, I've made a wager with Dr. Chen and Dr. Rodriguez here." He gestured dismissively toward the corner table where Laura sat alone with her sandwich. "Our new night nurse has been assigned to the vegetative care unit. Specifically to the 4-star general who's been comatose for 5 years after that IED blast." He paused, letting the significance settle. "I give her 1 week. Maybe 2 if she's particularly stubborn. The vegetative unit breaks everyone eventually. Especially the soft ones." Laughter rippled across the cafeteria like a wave. Crisp and cruel. Laura kept her eyes on her sandwich, watching the mayonnaise catch the fluorescent light. Her jaw tightened, just slightly. The kind of tension only visible if you knew where to look. Sterling saw the micro-expression and it fed something in him. He carried his tray toward her corner table, his movement slow and deliberate, a predator approaching prey that hadn't yet registered the threat. He stood over her. "What do you think, sweetheart? Think you can handle wiping drool and changing diapers for a vegetable who'll never wake up?" His voice was loud enough for the adjacent tables to hear. Several nurses pretended to eat. One resident suddenly found her coffee very interesting. Laura took one measured breath. She set down her sandwich with the precision of someone disarming an explosive device. Then she looked up, meeting Sterling's eyes directly. A single tear escaped down her left cheek, not from fear, but from the effort of what came next. She wiped it away without breaking eye contact, her hand steady as surgical steel. Her voice came out low, controlled, carrying a weight that seemed to reshape the air around it. "I've picked up pieces of people in Sangin. This is nothing." The room went dead silent. Silverware stopped moving. Someone's coffee cup froze halfway to their mouth. Sterling's smile crystallized on his face, no longer reaching his eyes. He'd expected resignation. He'd expected tears and apology and the soft dissolution that came with shame. He had not expected that voice. That tone. That calm certainty that spoke of things he couldn't access with money or position. The silence lasted exactly 3 seconds. Then Sterling's face flushed red, not with embarrassment but with rage at being challenged. He was not accustomed to being challenged. His hand tightened on his lunch tray, and in one deliberate motion, he knocked it off the table. Her tray clattered to the tile floor, charts scattering like white snow, her food splattering in a brown puddle that spread across the ground. The sound echoed through the cafeteria, the crash of ceramic against hard floor, the scatter of papers, the wet slap of her lunch spreading across the tile. "Pick that up, sweetheart," Sterling sneered, his voice dripping with venom. "And while you're down there, think about how you're going to explain your incompetence to your next employer." Laura stood slowly. Not frantically. Not with the jerky movements of someone humiliated. She moved the way a person moves when they've already survived the worst the world has to offer. She knelt and began gathering papers one by one, her hands steady, her breathing even. Her movements were economical, precise, revealing nothing. Around her, some nurses pretended to be suddenly very busy. Others watched, unable to look away. Patterson, the veteran nurse, watched from across the room and noted something in Laura's posture, the way her shoulders didn't round with shame, the way her hands didn't shake. The way she gathered those papers like she was collecting evidence. Sterling stood above her for another moment, then turned away when she didn't react further. "That's what I thought," he muttered, loud enough for the room to hear. She said nothing. She kept picking up papers, requisition forms, medication schedules, a napkin with coffee stains. She stacked them all neatly, set them on a corner of the table, and returned to her sandwich as if nothing had happened. Around her, conversation slowly resumed, but it was different now. Something had shifted in the room that no one could quite name. That same week, Sterling found another angle of attack. He reviewed Laura's charting in front of 2 residents during morning rounds, his voice pitched to carry to the nurse's station. "Look at this," he said loudly, tapping her chart with one finger. "She's requesting cardiology consults for a patient who's been brain-dead for 5 years. What's next, Bennett? A haircut? A manicure?" He tossed the chart at her feet, the papers cascading across the floor. "Denied. And if I see one more unnecessary requisition from you, I'll have you written up for wasting hospital resources. This is Mercy General, not a luxury resort." The 2 residents exchanged uncomfortable glances. One of them, Dr. Patel, had actually reviewed the general's chart and noted something was off with the cardiac markers. But he said nothing. Sterling's voice had that edge to it, the edge of a man who could make or break a residency with a single phone call to the right program director. Laura knelt, gathered her chart, and stood without looking at Sterling. Her voice came out like steel wrapped in velvet. "The record will show I requested it, Doctor." She filed the chart in the exact proper order, her movements unhurried, and walked away. She did not hurry. She did not look back. She did not give him the satisfaction of seeing her rattled. A veteran nurse named Patterson watched the entire exchange from the medication room doorway, eyes narrowing with recognition. She knew that voice. She knew that composure. She knew that specific way of moving that came from training in places civilians couldn't imagine. Week 2 began with a shift that felt heavier than usual. Laura moved through the general's room on her nightly rounds, checking vitals, adjusting his position, reviewing his medications with the meticulous care of someone who'd learned long ago that details meant the difference between life and death. The ventilator wheezed its mechanical rhythm beside his bed. His left hand lay across the blanket, calloused and scarred, and something about those scars pulled at her. Hands like that had pulled her from rubble once, after a mortar strike in Sangin turned the world into fire and dust. She talked to him sometimes during these rounds, describing Portland weather, the coffee in the break room, the way the rain smelled different here than it did back home. Anything but the thing she was trying to forget. It was 2:17 a.m. when the alarm screamed from room 351. A post-surgical cardiac patient, blood pressure plummeting, heart rate climbing past 140. Laura ran. She was in motion before she consciously decided to move, her body responding to that siren with the muscle memory of someone who'd answered calls in far worse conditions. 2 residents stood frozen at the bedside, fumbling with the crash cart, their faces pale. "Peripheral access won't hold," one shouted. "He needs a cut down, we're losing him." Laura didn't think. She didn't hesitate. She was back in a canvas tent with generators roaring and the sound of helicopter rotors distant but coming closer. Her hands moved with absolute precision that came from somewhere deeper than thought, from the place where training lives permanently. She identified the saphenous vein at the ankle, located it by feel, made a small incision with a scalpel from the sterile tray. Isolated the vessel. Threaded the catheter with the exact movements taught only in Special Forces medical certification. 90 seconds. The line was in. Fluid started. The patient's blood pressure began to climb. BP coming up, one resident whispered. 88/62. Laura sutured the incision with a specific knot pattern, one that only experienced combat medics used, the kind taught in field medicine courses, the kind that had to hold through movement and chaos. The resident stared at her as if she'd just performed magic instead of medicine. Nurse Patterson appeared in the doorway, having heard the alarm. She watched Laura finish the last suture, watched the way her hands moved, watched the specific technique being applied. Then Patterson excused herself and pulled Laura into the supply closet 10 minutes later. "I was Army, 68 Whiskey, deployed to Kandahar," Patterson said quietly, her voice low enough that only Laura could hear. "I know that work. That wasn't nursing school technique. That was battlefield surgery. What unit were you with?" Laura's hands started trembling. The first time they trembled since arriving at Mercy General. "I don't know what you mean." "Yes, you do. That cut-down technique, that suture pattern, that's JSOC training. 160th SAW Forward Surgical Team. Maybe 75th Ranger Regiment Medical Attachment." Patterson waited, her eyes steady. "What unit?" "I'm just trying to disappear," Laura whispered. The words came out smaller than she intended. "Please. I'm just trying to be invisible." Patterson studied her for a long moment, then nodded slowly with the understanding of someone who'd worn the uniform and decided to stop. "Your secret's safe." But Sterling saw the whole thing on the hallway camera. "Be careful. Men like that don't forgive competence they didn't create." Laura returned to the general's room an hour later. She sat in the dark beside his bed, watching the rise and fall of his chest, watching the machines that kept him tethered to life. Her hands had stopped shaking. Her breathing had returned to normal. But something had changed. The anonymity she'd built so carefully, the invisible existence she'd constructed, it was already cracking. And Sterling had seen it happen on a security camera feed he'd watched 100 times. He knew something now. He just didn't know what. But he knew it was a threat. And that made him dangerous. The fluorescent lights hummed their endless monotone as Laura pulled the general's chart during her second week of night shifts. She'd learned to read his rhythms like combat medical readouts, the language of vitals printed on graph paper, of subtle deterioration masked by routine. His heart rate variability had drifted upward. His central venous pressure climbing incrementally. The physical exam findings she'd documented, distant heart sounds, a friction rub she'd heard with her stethoscope pressed against his chest wall, painted a picture that made her blood move differently through her veins. Cardiac tamponade. Fluid crushing the heart. She didn't rush. She compiled her observations methodically across 3 pages of notes, cross-referencing his daily vital signs against the baseline imaging from admission. The chest X-ray from 5 days prior showed a widened mediastinum. Subtle. Easy to miss if you weren't looking. She was looking. She'd been trained to look when lives hung on the smallest detail, and muscle memory didn't retire, it just went dormant until it needed to wake up and kill you for overlooking something. Laura requested a meeting with Dr. Sterling during the day shift transition. She found him in his office, a space that smelled like old cologne and something else she couldn't name, something sharp that made her think of money, though money didn't have a smell. Sterling sat behind his desk, a man whose tailored white coat seemed to exist in a different dimension than the rest of Mercy General's staff. His eyes moved up from his computer screen with the slowness of someone who'd been interrupted during something important. "Laura." He smiled. It was a smile without teeth. "Everything all right?" She remained standing, a tactical choice. "I've been tracking the general's vitals across the past 7 days. Heart rate variability increasing, blood pressure fluctuating between 102 and 118 systolic, which is significant for a comatose patient with otherwise stable hemodynamics. Central venous pressure reading elevated on his last line check. I'm concerned about early pericardial effusion progressing toward tamponade." She paused. Professional. Clinical. Precise. "I'd like to request a cardiology consult. Today if possible." Sterling's eyes narrowed. Not the narrowing of concern. The narrowing of calculation. He leaned back in his chair, which creaked under the shift of his weight. Laura, I appreciate your diligence, but the General has had serial echocardiograms showing no significant fluid collection. The chest imaging is stable. His hemodynamics are compensated. The echo was 10 days ago. And it showed nothing. She held his gaze. Tamponade doesn't develop overnight. It progresses. If we're looking at early fluid accumulation, we need to intervene before he decompensates. Sterling stood. When he moved, the air in the office seemed to recalibrate around him, not threatening exactly, but present in a way that made her aware of the door being closed and the walls being thin. I understand your concern, but I'm the attending physician on this patient. I make the clinical decisions here. We're not calling in cardiology for every minor fluctuation in vitals. That's wasting resources on a patient with no significant change in status. Laura felt something crystallize in her chest. Not fear. Not anger either. Clarity. The kind you get when you're reading a combat situation and you suddenly see the geometry of it, where the threat is coming from, how many exits exist, what you have in your hands. With respect, sir, this isn't a minor fluctuation. The pattern suggests. I've made my decision. Sterling sat back down, a dismissal that was physical and complete. He turned his attention back to his computer screen. Continue monitoring. Document any changes. But we're not calling cardiology. That's the end of it. She left without another word. But that night, when she reviewed the General's chart during her 2 a.m. rounds, she found a formal written warning in his file, dated 4 hours after their conversation. Excessive resource requests. Medically unnecessary consultation attempts. Questions about her clinical judgment. Sterling's signature at the bottom, precise and deliberately slanted. The warning landed differently than insults ever could. Insults were information about the person giving them. Written documentation was architecture. It was the beginning of a pattern. She'd seen this before, in debriefs after operations that went sideways, informal statements used to blame failure on specific personnel. Sterling wasn't just dismissing her concern. He was building a file. Laura filed an appeal with nursing administration within 48 hours, presenting her observations with the same methodical precision she'd used with Sterling. The appeal landed on a desk belonging to Administrator Michelle Walsh, a woman in her 60s who'd spent 30 years navigating hospital bureaucracy and understood the difference between caution and obstructiveness. Walsh scheduled a meeting for the following Tuesday. That same Tuesday afternoon, Sterling made a phone call. The investigator arrived 2 weeks later, a contracted medical credentialist named Holloway who reviewed personnel files with the unhurried deliberation of someone being paid hourly. Sterling had been thorough. He'd arranged for Holloway to randomly audit Laura's credentials, her background screening, her references. One of those references was a retired captain from her time in the service, someone who'd been a supervisor nearly 8 years ago and hadn't spoken to Laura since her separation. Holloway called him at a number Sterling had provided. I'm calling about Laura Bennett, SCPO, who served under your command. We're doing a routine background review. Can you speak to her performance, her reliability, her judgment under stress? The captain, when he finally called Laura back that evening, was confused. They asked me about classified operations, Laura. About your mental state when you left. I told them the truth, you were competent, no issues, but why are they digging? What happened? She didn't tell him about Sterling. Didn't tell him about the warning or the denied cardiology consult or the file being built brick by brick. Administrative thing, she said. Nothing to worry about. But something had shifted. The hospital had an architecture now, and Sterling controlled the blueprints. The General's condition continued to deteriorate. On day 16, his oxygen saturation dropped below 94 despite supplemental oxygen at 5 liters. His breathing pattern had changed, more labored, subtly altered. Laura adjusted his positioning, knowing what was coming, recognizing the early markers of pressure building inside his chest cavity, of fluid crowding the space his heart needed to expand. She tried again to document it for the official record, adding her observations to his chart with clinical notation and zero editorializing. Sterling read her notes before rounds that morning. She watched him skim them, watched his jaw set, and then watched him pull her aside in the hallway outside the general's room. "Your appeals process has been denied," he said quietly. His voice was level, almost conversational. "But I've arranged for you to be reassigned starting next week. You'll be taking over care for the patients on the East Wing, second floor. Stable post-op cases. Less acute. I think it's a better fit for your skill level." Laura understood what was happening. It wasn't punishment yet. It was containment. Reassignment meant limited access to the general's records, reduced exposure to Sterling's fraudulent treatment protocols, removal of her from the one place where she could observe what was actually happening to the patient. "Doctor, the general still needs." "This isn't a discussion." Sterling's voice had changed pitch. Lower. The way a man speaks when he's making a threat he plans to deny making later. "You're reassigned. That's final. Nursing administration approved it an hour ago." She walked away. Didn't respond. Didn't let him see that she was running through scenarios, calculating time before the general's cardiac function collapsed completely, understanding that she was being systematically isolated from the one patient where she could actually help. The isolation was the real weapon. Not the warning, not the reassignment, not the file being built, all of that was secondary to the simple fact of being locked out. What Sterling didn't know was that Laura had already documented everything. Every chart discrepancy. Every missing treatment, every billed procedure never performed. She'd photographed pages with her phone at 3 a.m. when the night shift gave her access to records that Sterling assumed she'd never look at twice. 63 photographs. $17,000 worth of fraudulent charges just in the past 3 months. The evidence assembled in a cloud folder that no hospital network controlled, waiting for the moment when someone in authority with the power to actually do something with the information would be willing to listen. That moment wasn't here yet. But it was coming. Sterling had just guaranteed it by trying to silence her. 2:47 in the morning. The numbers on the monitor told Laura everything her eyes confirmed in the doorway. The general's neck veins distended like ropes pulled taut. Blood pressure collapsing downward, 92/58, still falling. Heart sounds muffled, distant, as if his heart was drowning inside his own chest. Beck's triad. Fluid crushing the organ. Cardiac tamponade. The kind of emergency that killed men in 30 minutes if nobody acted fast. She moved to his bedside without running, without the kind of panic that made mistakes. Muscle memory took over. Her hands were already reaching for the phone, already dialing cardiology, already speaking in the voice that cut through noise like a blade. Stat page for cardiologist on call. Mercy General, Vegetative Care Unit. Cardiac tamponade protocol. Patient is 4-star general, 5-year history of immobility-related complications. ETA 15 minutes maximum. The cardiologist would come. They had to come. She was documenting the progression on the monitor when Dr. Sterling appeared in the doorway at 2:59 a.m., moving with the irritation of a man pulled from his bed. His hair was uncombed. His shirt was buttoned wrong. He glanced at the monitor screen and his expression hardened into something that resembled stone carved in a government office building. "His baseline vitals are always unstable," Sterling said, not looking at Laura. "This doesn't warrant emergency intervention." She kept her voice level, steady as the hands that had performed surgery in sandstorms. "Doctor, he has cardiac tamponade. He needs pericardiocentesis now or he'll die within the hour." Sterling's jaw clenched. He turned to her, and she saw something flash across his face, not concern. Recognition. He'd realized in that moment that Laura Bennett could see what he did. More than that, she could fix it. And a competent nurse in his unit was a witness he couldn't control. "You're a nurse, Bennett, not a cardiologist. Return to your other patients." "That's an order." He turned to leave. The general lay there with his heart suffocating inside its own fluid. 5 years in a bed. A man who'd carried soldiers through firefights, who'd made decisions that saved lives and cost lives, now dependent on the people around him to notice when death was creeping in. Laura looked at his face, at the man who had walked through Sangin's dust like she had, whose boots had worn the same ground, whose hands had held lives together like she'd held lives together. She made her choice. The ultrasound machine was 2 rooms down. She retrieved it in 90 seconds and wheeled it back. No page to Sterling. No request for permission. Just the knowledge that the cardiology team was 14 minutes out and the general had maybe 10. She prepped the site at his lower left chest, found the subxiphoid approach, swabbed the area with antiseptic that smelled like copper pennies and efficiency. Her hands didn't shake. They never shook when it mattered. The needle was 14 gauge, long enough to reach the pericardial sac without perforating the heart. She advanced it at a 30-degree angle, watching the ultrasound screen, feeling for the resistance change the way she could feel 1,000 other things in the dark, the difference between a man who would make it and a man who wouldn't. The needle entered the pericardial space with the smallest give, a sensation like pressing through silk. She withdrew 120 milliliters of bloody fluid. The needle pulled back clear. The monitor response was immediate. Blood pressure rising. 60 seconds and he was at 108/72. Heart rate stabilizing. His color was already returning, the gray-blue fading into something that resembled life. She placed a pressure dressing over the insertion site and was documenting the procedure in his chart when the door opened behind her. Sterling. But not alone. 2 security officers. Hospital administrators. People who had been called from their homes and told to come now, no questions. Sterling's face had moved past anger into something colder, the expression of a man who saw the game board shift beneath his feet. Laura Bennett, Sterling said, his voice like ice in a medical freezer, you are terminated effective immediately for performing an unauthorized invasive procedure in direct violation of physician orders. You're a hazard to patient care. Security will escort you out. You have 5 minutes to collect your personal belongings. The words came down like a gavel. Terminated. Immediate. 5 minutes. Laura removed her badge. She placed it on the general's bedside table. She gathered her jacket, her personal items, the pair of worn combat boots she kept in her locker for shifts when her feet remembered Sangin and needed something familiar. She didn't speak. Speaking would waste the oxygen she needed to walk out of here with her spine straight. The hallway stretched toward the exit like a corridor in a nightmare. Past the cafeteria where Sterling had knocked her lunch tray to the floor. Past the nurse's station where Patterson stood with tears running down her face, watching, understanding exactly what had happened and why. Past the administrators who had taken Sterling's word over the chart notes, over the medical emergency, over the life saved by a nurse with hands that had learned surgery in places the Pentagon classified. The parking lot was empty. 3:47 in the morning and she was alone in the dark, standing next to her car, still wearing her scrubs with bloodstains on the cuff. She sat in the driver's seat for 2 hours without starting the engine. The sun came up behind the hospital building. Mercy General. The name was cruel. She drove home in silence. Her house was the same as it had been. Same blue door. Same mailbox. Same kitchen where she'd been trying to rebuild something from the broken pieces. Her 15-year-old son, Marcus, was eating cereal at the breakfast table when she walked in, his backpack on the counter, his day prepared the way mornings were prepared when nobody knew the schedule was about to disintegrate. Mom? Why are you home? His eyes went to the bloodstain on her scrubs. Did something happen? She sat down across from him. The words wouldn't come. They'd been locked away so carefully that she couldn't access them now. All she could manage was to put her head down on the kitchen table at 9:15 in the morning while her son stared at her like she'd become a stranger, and the weight of hiding finally became too heavy to carry alone. Marcus left the kitchen. She heard his footsteps on the stairs. She heard the attic ladder being pulled down. She heard him moving through boxes she'd sealed so carefully that she'd never looked at them herself, the medals in their frames, the dress uniforms in plastic garment bags, the photographs of a younger version of his mother standing in desert fatigues in front of a base that looked like it was made of sand and determination. 2 hours later, he was sitting in a hospital administrator's office with a shadow box in his hands, his voice cracking like ice breaking in spring water. "You fired my mom, and you don't even know who she is." The shadow box opened like a small door to another life. Dr. Sterling's face went the color of old bruises. He stood in the hallway outside the general's room, his jaw working as though chewing glass, and made the first call before Laura had even finished signing the discharge paperwork. Board member Hendricks answered on the second ring. Sterling had referred his son to a private orthopedic practice that paid quarterly kickbacks disguised as consulting fees. Board member Walsh owed him 6 figures in hidden referral money from the cardiac unit. Within 40 minutes, both had agreed to support whatever Sterling needed. The calls were surgical. Precise. Sterling didn't yell. He never yelled when he was truly dangerous. He simply stated facts. The procedure was unauthorized, the liability exposure was catastrophic, the hospital's insurance would crater if this got out. By 4:17 p.m., an outside investigator named Paulson was being retained, a man Sterling had used before, a man who understood that paperwork could be shaped like clay, that narratives could be rewritten if the right pressure was applied at the right angle. But that wasn't the worst part. Sterling made a second set of calls that evening, this time to the sparse handful of names in Laura's reference section. Her old commanding officer had retired to Pensacola and didn't remember much. Sterling used that silence, filled it with insinuation, behavioral concerns, possible PTSD complications, erratic decision-making in high-pressure environments. The medical director at Bethesda Naval Hospital took the bait. Sterling's voice was smooth as oil. "I'm not saying she's unstable, but a senior chief with potential psych issues in a vulnerable care unit. I wanted to check before something happened." The message was clear: Laura Bennett might be a liability. The story would spread. By midnight, Paulson had filed a preliminary report citing credentialing irregularities and procedural violations requiring immediate disciplinary review. He'd never even met Laura. Laura signed out on Wednesday at 11:43 p.m., expecting to return Thursday. By 7:56 a.m. Thursday, Paulson's investigator was photographing the pericardiocentesis needle tray, measuring distances, interviewing the 2 nurses who'd assisted Laura during the procedure. By 9:15 a.m., Sterling had convened an emergency credentials committee. By 11:51 a.m., Laura was being called into the administrator's office. She knew something was wrong the moment she saw the security guard standing by the door like a statue carved from regret. Sterling sat behind the table with Hendricks and Walsh flanking him like remoras on a shark. His voice was soft, which made it worse. "Senior Chief Bennett, the executive committee has reviewed your actions on the evening of March 14th. You performed a procedure outside your scope of practice without physician authorization. You violated hospital protocol. You endangered patient safety for personal aggrandizement. We have no choice but to terminate your employment effective immediately. Security will escort you to your locker. You're required to surrender your badge and credentials before you leave the building." Laura didn't move. She didn't flinch. Her hands were perfectly steady as she reached for the termination letter, her eyes scanning the language: unauthorized procedure, reckless endangerment, gross violation of professional standards. The words were constructed like accusations, and underneath them ran Sterling's voice like a wire current. She looked at him, actually looked at him, and something in her expression made him lean back slightly. "I saved his life," she said, each word separated by a breath of air between them. 8 words. That was all she had. "You broke protocol," Sterling replied, and the trembling wasn't fear. It was restraint. His jaw was working. He'd expected tears or anger or a fight. He'd expected something breakable. She stood, placed the letter on the table, and walked toward the door where the security guard was waiting. His name was Martinez, and he looked at Laura with something that might have been recognition or might have been apology. He said quietly, and there was nothing she could say to that. The ride home was silent except for the rain. Portland rain in March sounds like typing, like someone documenting everything that's falling apart, and Laura drove with both hands on the wheel at precisely the speed limit, her mind very far away and very close at once. Her apartment was cold. Her son Marcus should have been in school. He was sitting at the kitchen table at 2:04 p.m., still in his backpack, holding a bowl of cereal that had gone soft in the milk, and he looked up when she came through the door and his entire face changed. "Mom? Why are you home? Are you sick?" She sat down across from him without answering, and his cereal spoon clattered into the bowl. He knew then. Teenagers are radar for adult collapse. "I don't want to talk about it right now," she said, which was the wrong thing to say because it meant the leaving was real, the humiliation was real, and her carefully constructed invisible life had just exploded across the linoleum like dropped glass. Tears came, not the controlled kind she'd practiced, but the real kind, the kind that came from somewhere deeper than training. Marcus abandoned his cereal and knelt beside her chair and didn't ask any more questions. 2 days later, Marcus skipped his afternoon classes and did something that would change everything. He went to the attic of their apartment and found the shadow box his mother had hidden behind the insulation, the one she'd brought from her deployment bag 7 years ago and never unpacked. He lifted it down carefully, the way someone handles something that might detonate. Inside, behind glass, were medals on ribbons, a Purple Heart with its distinctive purple and gold, a Navy Commendation Medal with Combat V device, and 3 Bronze Stars, 2 of them also bearing the Valor device, the metal emblem that meant she'd done something extraordinary while people were trying to kill her. His hands were shaking as he carried the shadow box to Mercy General and walked into the administrator's office. He wasn't nervous. He was something worse than nervous. He was certain. The administrator, Dr. Kessler, was mid-sentence in a budget meeting when Marcus stood in the doorway holding the shadow box like an accusation. "My mom is Senior Chief Petty Officer Laura Bennett," he said, and his voice only cracked slightly. "They need to see these." He set the box on the desk and opened it. Silence fell. The kind of silence that happens when the world adjusts itself. Kessler's hands trembled as she reached for the Purple Heart. "What unit?" she whispered. A trembling nurse practitioner named Chen pulled Laura's file and began reading aloud, 3 Bronze Stars. 2 with Valor device. Purple Heart. Navy Commendation Medal for Combat Medical Operations in Sangin. The words landed like stones in still water, each one sending ripples. In the corner of the office stood a visiting retired SEAL team leader named Travis McKenna who'd come to see his father in palliative care. He stepped forward and his barrel chest expanded. His voice was thick, the kind of thick that comes from recognizing something sacred. "That first Bronze Star is for pulling 5 men from a burning Humvee while taking fire. The second Bronze Star," he paused, swallowing hard, "that's for 14 hours of mass casualty surgery in a collapsed aid station in Sangin while the building was coming down. And that," he pointed at the Navy Cross, "that ultimate decoration." His finger trembled. "That's beyond Valor. That's beyond anything most of us will ever understand." 3 minutes later, the FBI agent who'd been quietly investigating Sterling's billing fraud for exactly 6 months and 12 days stood in that same office with his laptop open, and his voice was the voice of someone who'd finally found what he was hunting for. "We have everything we need," he said, and he meant it. Security footage Sterling attempted to delete. But our IT administrator, a Marine named Cortez, he suspected something was wrong. He preserved every frame. "We have Sterling on camera falsifying treatment logs, documenting payment distributions through the shell company, signing off on fraudulent procedures that were never performed." The FBI agent's face was carved from professional satisfaction. "This goes federal. Healthcare fraud. Insurance fraud. Wire fraud. We move tomorrow at 6 a.m. The next morning, Sterling was performing his routine, checking charts in the hallway outside the general's room, when 5 agents in windbreakers walked through the main entrance and asked him to come with them. They were polite. Federal agents are always polite when the arrest is certain. They walked him past the cafeteria, past the exact spot where he'd knocked Laura's lunch tray to the floor and called her sweetheart in a voice that had probably seemed like power. No one was there to see it. That was the mercy, or the cruelty, depending on how you looked at it. Just an empty cafeteria at 6:56 a.m. with the coffee station beginning its morning brew. Within 72 hours, his medical license was suspended pending review by the State Medical Board. Board members Hendricks and Walsh had resigned, their referral arrangement suddenly exposed to the light like creatures that only live in darkness. The investigator Paulson was himself suspended for accepting payment to fabricate discipline findings. Sterling's wife filed for divorce. His attorney negotiated a plea deal, full restitution, 5 years probation, permanent surrender of medical license, 500 hours community service. At the sentencing hearing, the judge turned out to be a Marine Corps veteran, Vietnam, 23 years of service. She looked at Sterling for a long moment before speaking. "Dr. Sterling, you stole from the men and women who served this country, and you endangered a patient's life to cover your crimes. You will pay back every dollar, and you will never practice medicine again." It took 9 seconds. That was all it took to erase a 30-year career. 6 months later, Sterling was teaching CPR certification at Portland Community College for minimum wage, his hand shaking slightly as he demonstrated chest compressions on a plastic dummy. His voice had lost its smooth edge. It just sounded tired. Meanwhile, Laura was standing in the general's room 3 months after her reinstatement, full back pay, a formal written apology, and an offer to direct the new Veterans Care Unit being established with a $2.3 million grant from the Department of Veterans Affairs. She was holding the worn combat boots that had walked beside hers through Sangin's heat and dust for 14 months, the same boots that had been in a plastic bag in her apartment closet. She placed them carefully on the shelf where the general could see them if his eyes ever opened. She didn't know it yet, but they would. Within 3 months, his right index finger would twitch during a neurological assessment. His pupils would begin responding to light again. The brain, sometimes, finds a way back. And when it does, the first thing he would see would be those boots waiting for him, and a woman with scars no one could see, telling him in a voice like steel wrapped in velvet, "We made it, General. Both of us made it out." If you've ever been invisible because of what people assumed about you, or if you know someone who's carrying a secret service that changed them in ways the world can't see, I want to hear your story. Comment below and tell us about the unsung heroes in healthcare and military service who've overcome systemic barriers to save lives. Don't forget to like this video and subscribe. We're building a community that recognizes the quiet warriors among us.